Welcome to NSG 412, Study Session 10, Objectives and Components of School Health. Introduction. In this study session, we will present the objectives of school health services. We will also highlight the criteria for promoting a school health service as annotated by WHO. Learning outcomes. When you have studied this session, you should be able to 1. Highlight the objectives for school health services. 2. State the criteria for a health-promoting school by WHO. 3. Present the components of school health services. 1.1 Objectives of school health services. We examined the concept of school health service in the previous study session. Here, we will present the objectives of school health services, which are to promote healthful growth both mentally and physically among school children, to produce a well-adjusted, physically vigorous child who is free from disease, to make sure every child is as fit as possible to gain maximum benefit from his or her education, to make a child become aware of the importance of health and develop healthy practices, health knowledge, attitude, and appreciation towards health, to develop healthy physical and psychological environment for the child, to promote a state of health, treat minor ailments, prevent diseases, and maintain the health of school population, to diagnose and treat any disability and illness before complications set in, to prevent the occurrence of and spread of communicable diseases among school children, to provide emergency care for school children and, if necessary, their teachers, to instill principle of healthy living in the school children and members of staff through examples from health personnel and demonstration, create awareness of the collaborative efforts of the school, home, and community in health promotion, develop health consciousness among the learners, create awareness of the collaborative efforts of the school, home, and community in health promotion, develop health consciousness among the learners, create awareness on the availability and utilization of various health-related resources in the community, promote collaboration in a world of interdependence, social interaction, and technological exposure in addressing emergent health issues. Build the skills of learners and staff for health promotion in the school community. 10.2 Who criteria for a health promoting school? Take 2. 10.2 WHO criteria for a health promoting school. The 12 WHO criteria for a health promoting schools are: 1. Active promotion of self-esteem of all pupils by demonstrating that everyone can make a contribution to the life of the school. 2. Development of good relations between staff and pupils and among pupils in the daily life of the school. 3. Clarification for staff and pupils of the social aims of the school. 4. Provision of stimulating challenges for all pupils through a wide range of activities. 5. Use of every opportunity to improve the physical environment of the school. 6. Development of good links between school, home, and community. 7. Development of good links among associated primary and secondary schools to plan a coherent health education curriculum. 8. Active promotion of the health and well-being of the school and staff. 9. Consideration of the role of staff as exemplars in health-related issues. 10. Consideration of the complementary role of school meals, if provided, to the health education curriculum. 11. Realization of the potential of specialist services. Take 2. 11. Realization of the potential of specialist services in the community for advice and support in health education. 12. Development of the education potential of school health services beyond routine screening and towards active support for the curriculum. 10.3. Components of school health. The 2006 National School Health Policy, released by the Federal Ministry of Education, Nigeria, has identified the following as components of school health. 1. Healthful school environment. 2. Nutritional care or school feeding service. 3. Skill-based health education. Take 2. 3. Skill-based health education. 4. School health service. 5. School, home, and community relationship. 10.3.1. Healthful school environment. The following characteristics are indicative of an healthful school environment. Location of schools away from potential environmental hazards. Protection of the school community from excessive noise, heat, cold, and dampness. Provision of adequate buildings constructed in line with approved standards with particular emphasis on facilities for physically challenged learners. Provision of an appropriate and adequate amount of furniture for learners and staff. Provision of an adequate number of gender-sensitive toilet facilities. Provision of adequate safe water supply and sanitation facilities for the school community. Provision of proper drainage and waste Provision of proper drainage and waste disposal facilities. Provision of safe recreational and sports facilities. Perimeter fencing of the school. Observation of annual school health days. Promotion of healthy human relationships in the school community. Promotion of health-related school policies. Promotion of a maintenance culture. 10.3.2. Nutritional care or school feeding service. This is important for physical, mental, and immune development. School feeding services are aimed at providing an adequate meal a day to all children enrolled in schools nationwide. Characteristics of school feeding services. 1. Provision of at least one adequate meal a day to school children. 2. Adequate sanitation and hygiene practices among food handlers, including routine medical examination and vaccination, regular screening for infectious diseases, retraining programs. Take 2. Retraining programs for food handlers, vendors, and regular inspections of their homes. 3. Food fortification and supplementation. 4. Regular deworming. 5. Promotion of health-related school policies. The case for school meal service. 66 million primary school-age children attend school hungry across the developing world, with 23 million in Africa alone. There are 67 million school-age children who do not attend school. Poor households must often choose between sending their children to school or to work in the fields. A daily school meal provides a strong incentive. Take 2. A daily school meal provides a strong incentive to send children to school and keep them there, and allows the children to focus on their studies rather than their stomachs. Why school meal service? Nutrition. When combined with deworming and micronutrient fortification, school meals offer important nutritional benefits. Social protection. School meals can break the cycle of poverty, hunger, and child exploitation in the world's poorest areas. They can also reach children affected by HIV/AIDS, orphans, disabled. Education. School meals encourage poor households to send children to school and keep them there. Supplementary benefits. Schools are the center of many villages and communities. School meals connect teachers, parents, cooks, children, farmers, and the local market. School meal service. The Nigerian picture. In April 2012, the state of Osun in Nigeria pioneered a statewide school meals program for all public elementary school pupils. It is called the All Meals Program, an acronym for the Osun Elementary School Feeding and Health Program. As of July 2014, it was providing lunch to over 252,000 children in 100% of Osun's elementary schools, in addition to staples such as rice, beans, and yams served with stews. Take 2. In addition to staples such as rice, beans, and yams served with stews, soups, and vegetables, the program provides daily fruits. Its estimated cost is 50,000 naira, US dollars 0.31. Take 2. US dollars 0.31 per child per day. Within 4 weeks of the All Meals launch, school enrollment increased by approximately 25%. According to the Nigerian National Bureau of Statistics July 2013 edition, Osun has the highest primary school enrollment rate in Nigeria, a feat largely attributable to All Meals, Nigeria's first national homegrown school feeding program, which would affect about 5.5 million Nigerians in the first year of its operation, would be running out soon in several states. 10.3.3 Skill-based health education. Skill-based health education is to promote the development of sound health knowledge, attitudes, skills, and practices among the learners. Health education is education for life. Therefore, emphasis should be placed on skills necessary for promoting appropriate behaviors and practices as against just theory-based lessons. Areas to be covered by skill-based education curriculum are personal health, diseases including HIV and AIDS, mental and social health, first aid and safety education, community health, family life education, environmental health, maternal and child health, nutrition, consumer health, drug education, aging and death, bereavement education, parts of the human body, health agencies. 10.3.4 School health services. School health services are preventive and curative services. Take 2. School health services are preventive and curative services provided for the promotion of the health status of learners and staff. The purpose is to help children at school to achieve the maximum health possible for them to obtain full benefit from their education. School health services shall include pre-entry medical screening, routine health screening or examination, school health records, sick bay, first aid and referral services. It shall also provide advisory and counseling services for the school community and parents. Characteristics of school health services: appraisal of the health status of learners and school personnel. Take 2. And school personnel through pre-entry screening, routine medical and psychological examinations, health counseling of the school community by counselor or social worker, referrals and follow-up health services between the school, community and the health facilities, health screening and the maintenance of routine health records in the school, prevention and control of communicable and non-communicable diseases through inspections, exclusions, readmissions, educational measures, immunization, sanitation and epidemic control, provision of special health services for learners with special needs. 10.3.5 School, Home and Community Relationship. The first health educators of the child are the parents, who shape the child's habit from infancy. Long before the child is ready for school, the parents should secure needed immunization and medical care and inculcate good habits into the child. The success of the school health program depends on the extent to which community members are aware of and willing to support health promotion efforts. Parents and community members should make inputs regarding the design, content, and assessment of the SHP. Characteristics of school, home, and community relationship. Home visits by teachers, school nurses, and school workers. Take 2. And social workers. 2. Regular visits of parents to school. 3. Regular meeting of teachers and parents, PTA. 4. Regular communication of the health status of the learner to the home by the school health personnel and the teachers. 5. Active participation of the school in community outreach activities and campaigns. 6. Active participation of the school in community health planning, implementation, monitoring, and evaluation. 7. Advocacy and community mobilization for the SHP through traditional and modern media. 8. The community shall be involved in the promotion of health-related school policies. Study session summary. In this study session, we listed in an explicit way the various objectives of school health services. We also stated the criteria for promoting a school health service by WHO. End of study session 10. Thanks for listening.